In May 12th of 2022, Bernie Sanders, along with 14 of his colleagues, introduced into legislation his Medicare for All plan, which was basically the marquee highlight proposal that he used when he ran for president back in 2020. Medicare for All has been billed by many as effectively an attempt to bring the United States into the world of socialized healthcare or socialized medicine. Good morning, everybody. My name is Dr. Sean H. Williams, and I am the lead professor and director of the Kentucky Heartland Institute of Public Policy here at Campbellsville University. Thank you for joining me this morning for another episode of our 2022 senior seminar class. I have joining me today 4 of our amazing students. I have with us Carly O'Neill, Ms. Bethany Davis, Kylie Crowley, and Savannah Reed. Ladies, thank you very much for joining me today. So today we want to talk about this idea of socialized healthcare and socialized medicine. And really we're doing this more from a comparative perspective, because if the United States is actually going to consider adopting socialized healthcare as a plan or a strategy, it probably is a good idea to start off by looking at how other countries have used it and whether or not it has worked for them. So if one of you guys would get me started, what exactly do we mean when we talk about socialized healthcare or socialized medicine? How is it different from the system that we have now?
It's where socialized healthcare is when everybody who pays their taxes, a certain amount of their taxes go into this national healthcare system. So that way people at least have to pay less, or in some cases they might not pay anything at all in order to receive healthcare. Whereas in this country, we typically rely on private health insurance, and a lot of people have to pay deductibles and co-payments.
How does that functionally work? I guess maybe a better question is, why would a country decide to adopt such an approach? What's wrong with the way that we do it right now?
Well, socialized healthcare kind of allows everybody to share the prices of affording healthcare, which kind of means that it's universally available to everyone. And in systems like that, it just works a lot better because the less fortunate or even the really fortunate can afford quality services. In the United States, it's not necessarily that way.
What were the logical origins here? How did this idea of socialized healthcare get started in Europe? Was it just, have they always had it? Was it something they've adopted recently?
So socialized healthcare actually didn't start in Europe. The idea began in the US in the 1930s, and it actually ended up transferring to Europe. They sort of adopted more policies, and the US kind of just fell off that track when others were running for president and they were getting out of the Cold War era, and it just didn't end up actually working in the US.
So you're saying that this is an American export to Europe that we decided to abandon, kind of like the League of Nations? That's yes. Exciting. What are some of the countries that use socialized healthcare?
There's many European countries that use socialized healthcare. In my research, I found a lot about countries like Denmark, Finland, Sweden, France, and Germany. There's also countries like Portugal who use it, and a lot of countries in the EU, because I was looking at data as the EU, like the money that they spent on healthcare in general, and also those individual countries as well.
I read something that said that socialized healthcare, like the concept of it, kind of started in Germany, but it started way back in the 1880s, and 1883 is what my notes say. But I think that was more of the concept. I don't think it was the socialized healthcare that we see in practice today. And then, yeah, like Bethany said, all those countries, there's so many countries that use it. I think it's over 30 countries have socialized healthcare systems, or I guess you could say partially socialized healthcare systems.
So I guess if they're going to adopt it and if they're going to keep it, there's got to be some kind of benefits. So the first logical question, I guess, would be, do countries that use socialized healthcare, are there any actual health benefits from its practice or its application, or is this just financial?
I think a lot of the times in countries that don't have socialized healthcare, in places that you do have to pay for individual healthcare plans, such as the United States, there's many times where people avoid getting the help that they need for health issues because they can't afford it or because it's going to put them into debt. So I think socialized healthcare is already a step up. For that reason, people can go for anything that they need in order to keep themselves healthy because they don't have to worry about the burden of getting that care and then later on having to figure out a way to pay for it in full.
So that's a great logical argument. Is there any evidence that it actually happens that way? That people really do stay healthier because they get health care more often?
I think several of our papers kind of touched on some of the same things. Because I mentioned I want to say I mentioned in my paper, but I know that somebody else mentioned like mental health, because my paper kind of focused on like reduction of stress as a result of socialized healthcare. But I feel like a lot of our research kind of picked up on the same things about socialized healthcare, like improving mental health, which has a lot to do with your physical health too. Your mental health affects everything you do, but so I just feel like socialized healthcare like helps with that for sure. But there's other, I guess, benefits I could say that aren't related to health whatsoever. And Carly's paper talked a lot about like labor and how the labor system is affected by socialized healthcare and some of the benefits that you can see in like laborers. My paper talked about that, and I want to say maybe Bethany's did too. We all kind of had similar things in our research, but.
And Kylie's paper did mention that 60% or around 60% of bankruptcies in the United States families are because of overbearing medical expenses. So that's also a really good point.
So those are financial things, but like, will I live longer? Will I lose weight? Will my hairline come back if I were operating under the socialized healthcare system? Or is it essentially the same health outcomes, just maybe I don't have to worry about the short-term pressures of the costs?
No, there definitely are health benefits. My research showed that, like, for example, people in Europe on average live between 3 and 5 years longer than people in the US. And not to mention that, but you can see it comparatively in countries like Turkey, who didn't really introduce socialized medicine until 2005. And their mortality rates, for example, like just for infants, have gone down by a quarter, young children a quarter, elderly about 10%. And so there definitely are a lot of health benefits. You can live longer. Mortality rates go down.
You had mentioned a second ago the problem of bankruptcy. I mean, it seems like if I can afford my own health care, will I also benefit, or is this a benefit that's mostly being realized by people who can't afford it or people who are lower income?
Well, you could benefit from it if you suddenly lost your job.
Well, going off of what Savannah said, I also think that socialized healthcare, which I did not find this in my research, I didn't really center around this, but I think I can make the argument that socialized healthcare was probably a better system to have in place when COVID was running rampant around the world, just because everybody was, well, a lot of people suffered like loss of their job and other like business factors, like the economy suffered. And I also think that because so many people were in hospitals, socialized healthcare, like it could be a con that they can't really turn people away, but it's also a benefit that everybody gets quality care that they deserve and are entitled to by their universal human right.
That's an interesting point that you make. Oddly enough, I don't know if any of y'all had experiences with COVID, but during my COVID experience, my healthcare actually became socialized. This weird thing happened where I had to go to the emergency room because of what I was doing with COVID, and so did my spouse. But there was a federal program in place that actually picked up all of the costs of COVID during COVID. And so that meant that I didn't have to pay anything. I didn't know that whenever I went. We were expecting a hospital bill of like $3,000 or $4,000. And instead, my health savings account has more money in it than I've ever had in my entire life. Because the money we had put back to cover these costs, the government ended up picking them up for us. And so we just didn't have to spend it. So if that's true, if logically there are health-related benefits, are there any non-health related benefits? So for example, are there any benefits to the broader economy? Are there any benefits to the labor market? Is there anything else that happens that would suggest that there's got to be a reason why these countries have kept socialized medicine for so long?
There definitely are. Yeah, I talked about a lot of a main factor of socialized medicine being higher job retainment. And it definitely shows that, people live longer, they're healthier, they work for longer. Just not even to mention that careers in Europe have much more and better benefits than those in the US. But it contributes to also a higher national GDP, higher individual income, better standard of living, overall higher happiness. It just has a lot more effects outside of health.
Yeah, going off of what Carly said, in my research, I picked up that laborers experience, socialized healthcare is believed to cause an increase in job quality and boost salaries. And it also affects like other socioeconomic factors because citizens are presented with the opportunity to redirect their finances and energy to alternative socioeconomic aspects. But specifically with the laborers, it does increase their life satisfaction and their job quality.
Although there are a lot of benefits, as we're all talking about, personally, from living in a country where there was socialized healthcare for quite a few years, in my experience, there is opportunity for everybody to access healthcare, but there is levels to it. So somebody who maybe can't afford the best healthcare is still going to have to experience a level of care that might not be to the same extent as someone who can afford it and maybe go a little bit farther out of their way to access healthcare. So I think even though there are a lot of these even outside benefits economically and stuff, there's still a class difference, especially when looking at the government. Like the government handled care is not going to be as thorough as something that somebody might pay for. Even though they have access to the free one, it might not be as thorough as the one that they could pay for.
And I think that's the fear here in the United States, right? That we'll end up with this kind of tiered healthcare system where rich people get really good healthcare and poor people get really bad healthcare and are forced to go to the really crappy hospitals. Do you feel like that's a legitimate concern based upon what you were arguing? Do you think that America would have a healthcare system where poor people would be worse off?
I definitely feel like it is a concern, especially as people are looking for jobs. I would say that maybe less qualified or less experienced medical professionals are left to handle the government mandated healthcare systems, while those who might have studied internationally are put in the ones where it's paid for. So I think that's definitely could be an issue if America was to adopt that system of healthcare. I think it could definitely create a tiered system, and those who have less money to begin with would be stuck with getting the less good care.
I think one of our discussion questions kind of asked something to do with like like, did the benefits outweigh the cost, basically? I don't think that's how you worded it, but it had something to do with that. But I think that even if our system was tiered, there's like steps to make in the right direction, and I think socialized healthcare would be a step in the right direction, but that doesn't mean that's the end of the road. There's going to be more reforms that you'd have to implement within a socialized system, just like there would be with any other system. And I don't think that because it could cause a tiered system, I don't think that that necessarily takes away from the benefits of socialized healthcare.
What about the rest of you guys? Do you think that the overall costs or expenses or the downside of socialized healthcare, do you think they outweigh the benefits? Or do you think that on the whole, European countries are better off having socialized healthcare than not?
I think on the whole, it's a lot better. I know that one of the sort of downsides are that countries have higher tax rates. So I think like Sweden pays 14% taxes to the healthcare program. But I think it's one of those things that it's like if you never see it, it's kind of not there. So it gets taken out of their checks just like it does for us. But because it's not really, I don't know, like it's not something that was supposed to go, like it doesn't go to them and then they have to pay it out. It's just automatically there. So I think it's one of those things that, yeah, it's kind of high for tax rates considering the US pays like between 8 and 9%. But I don't think it's that big of an issue that it outweighs the benefits.
Do you all think then that that this level of taxing, that it doesn't take, or it's cheaper in the overall run than paying for your own health care as well, if you're paying these taxes on every paycheck in order to for the socialized health care? Or do you think that like our system of healthcare in America, paying for a private plan is more expensive in the long run?
I think it's oh, sorry.
No, go ahead.
I think it's cheaper to pay out like that, like through socialized ways. Personally, like I've had 4 surgeries, like 2 in the past 2 years, and like I had an hour and a half surgery 8 weeks ago, and it cost $50,000. And without insurance, there's no way you'd be able to pay for that personally. And so I think paying 14% out of a paycheck is going to be cheaper in the long run than paying for 4 $50,000 surgeries.
I mean, and I think that's one interesting way of thinking about it is, are you participating in a healthcare system? So, for example, in some countries, they think of it as you're paying 14% in order to get access to this thing. In other countries, like maybe a Great Britain doesn't actually hire the doctors. Rather, the doctors are independent contractors. And it's more like you're buying insurance. Like you have a mandatory insurance payment that all Americans have to pay, rather than my employer has an insurance payment that I can choose to buy insurance. And if you think about it that way, I mean, man, $50,000 for a surgery, having to do that 4 times, that's a home that you can't buy if you've had that many kind of medical procedures.
That was my, well, not specifically, but that was kind of the basis of my argument in my paper, that socialized healthcare allows citizens to like divert their finances and redirect them in different ways, because you don't have to worry about, I mean, if you do have medical problems or something random comes up and it ends up costing you a fortune, if you don't have socialized healthcare, like things like that, you don't have to budget for those. So that allows you to redirect finances to other ventures. So I mentioned in my paper that because people have more money, now because they don't have to worry about medical expenses, they can use that money to put into like business ventures or put it into the economy in another way, or seek further education or maybe travel more. And there's benefits to all of those things that just stem from socialized healthcare. It's kind of like a domino effect. There's a lot of things that socialized healthcare can benefit.
So here's why I'm really kind of confused then. I know the four of you well enough to know that you represent kind of a diversity across the ideological spectrum, right? You're not all for liberal, you're not all for conservative. And you all four of you seem to be making this argument that we should be abandoning private sector healthcare and moving towards something more like socialized medicine. Why don't we have it if the four of you who come from four ideologically different positions, if you agree that we should have it, why hasn't America adopted this?
Because a lot of people don't want to pay the taxes towards it.
I think it's the taxes, but I also think it's just admitting that America is not as capitalist as we want to be. A socialized system maybe would be considered by some Americans to sacrifice some of America's pride. I think it would be my argument, but not all of us feel that way.
I think jumping off of that, there's also might be a misunderstanding about what socialized healthcare actually means and what goes into it. Just hearing the words universal healthcare, socialized healthcare is kind of could be a buzzword for some people. They don't actually understand the concept, but might feel that that's not the right direction America should take.
I think a lot of people are kind of like individualized thinkers rather than thinking about a whole. And so a lot of people might say, well, if I can afford to pay for my own healthcare through insurance, why am I going to help pay for everybody else?
I think that's the argument that goes with other social welfare aspects. That's the exact argument that parallels in so many different social welfare aspects, like I said.
And although I do lean towards that the system could benefit America, as I was saying earlier, it's not the end-all be-all. Like, it's not a system that you just put it in place and everything is fixed because of the tiered system like I was talking about, or because of the access different people have to different levels of care. It definitely would not fix every issue, although I think it would be a good place to start.
So then I guess we're just about out of time, but I guess I'll just go around the room. Would each one of you then say that the United States should adopt something like a European-style socialized healthcare system? And if so, give the strongest argument why you think that's the case. Carly, let's go ahead and start with you.
I think they should. Realistically, I don't think they ever will. But, I think it would do a lot for America. We're in trillions of dollars of debt. Hopefully an increase in GDP as an effect would help that come down. We have one of the highest homelessness rates in the world. So much of that is, like someone said, like 60% is due to financial loss like that through healthcare. So I think it would be a great benefit to other aspects of society other than just healthcare. But realistically, I don't think it's ever going to happen.
I'm kind of on the edge, as I was saying, just because of what I have experienced. But I think one of the concerns that I have if it was adopted in the United States is just the quality of care, if it would decrease, because if they have to provide care for everybody who comes in, they can't turn anybody away. They were having to turn people away just from lack of space during COVID. I'm just kind of concerned about if the quality of care would diminish because of the amount of people that would be seeking it. However, I think it's really important that everybody who needs healthcare has access to it. As I was talking about earlier, I don't think people should have to worry about going into thousands of dollars of debt just to seek out the medical care that they need. So I think that it would be a good start. Like I said, I don't think that it would solve every issue we have, but I think that it's really important for everybody to be able to at least have access to the care that they need.
A lot of people, they don't really think about this, but regular doctor's offices, they can actually turn you away because you don't have insurance. So when somebody who doesn't have insurance really needs to see a doctor, they will go to the ER because that's one place where they can't get turned away. So I guess you could say that it kind of like leads to abuse of the ER, which causes the ER to get really backed up. And because they can't pay their bills, it causes everybody else's bill to go up.
Ms.
And
Crowley, looks like you get the final word.
Oh, yay. I'm not ignoring that there are cons to socialized healthcare, but I feel like implementing a more and increasingly more socialized system, maybe over time, would reap all of the benefits of the improving household finances and job quality, boosting salaries, causing citizens to live longer and lead healthier lives, and have better job attendance. All of those benefits are a result of socialized healthcare. And I know there's cons, and I'm not ignoring those cons, but I do feel like the benefits outweigh the costs in this situation.
Well, there we have it. It sounds like maybe the Democrats have a better chance in the next round of presidential elections than we thought if most of the people your age, regardless of your ideology on other issues, think that socialized healthcare is a pretty good idea. So for those of you who are watching this either live or who are catching this on live stream later on, this is part of our weekly series, and please join us next week again at 8:30 in the morning on Thursday. We're going to be discussing the impact of social media on American politics, and specifically considering whether social media is contributing to the growing partisan divide, or if maybe the partisan divide is happening on its own, and all social media has done is just sort of revealed something that's going on underneath the system. So until next time, thank you very much for joining us, and God bless.